So if a patient comes in and they're wearing a denture, what
Yeah.
are their options when it comes to dental implants?
Yeah, sure. Well, the simplest thing, Randy, is to put snaps in on the bottom first. So just that changes everything. The denture actually, it's like snaps on a jacket. There's 2 snaps on the implant. There's snaps in the denture, and they fit in over those snaps, and they don't come out, and they don't wobble around when you chew anymore. The next step after that, you might do the upper the same way, and then so both come in and out and snap.
Can they eat well with those?
It improves their eating, all right? But because it's just on 2 snaps, the dentures still do have a little bit of movement. It's not the same as a denture. You don't have to glue them in. You're done with the glue. But the next step after that is really where you can start to chew better. So you add an implant or 2 more, and now the denture snaps onto a bar. You still take it in and out,
in there.
but you can rely on it being solid now. Okay.
Like salads, broccoli.
Salads, cutting through with your front teeth. So if you want to bite an apple again, if you want sweet corn at that August picnic, okay, that's what that's about. And then the next step is really a full tooth replacement using dental implants as the baseline support. So at this point, the roof of your mouth becomes exposed again. So now you get the feeling and the taste of food back.
Like with what, 4 or 6 implants to give them a full arch?
Yeah, four or 5 or 6, depending on the arch. Whether it's upper or lower. But again, now they come in, they don't come out. You go back to cleaning them like teeth, and it's important that there is follow-up.
And you guys do that, right? You have a complete program.
We call it dental fitness in our practice, and there's literally a score, okay? And I've got Jill, the hygienist, that's really the best at what she does, and she just has a way about her that keeps you comfortable, and it's a coaching relationship, Randy. We know we're doing a great job as a coach when the players are winning, okay? So that it really is our intent then to keep that the work we do lasts the rest of a patient's life. So once again, when you go to tooth replacement with implants, you open up the roof of the mouth, and now you can taste food again completely. You brush them like teeth.
And you could be 80, 90 years old to do this.
Yeah, age is really not a factor anymore.
Now, most of these people, as you explained, they're sedated. So you're monitoring their blood pressure, their heart rate, their oxygen.
Yeah, their heart rate.
So they don't really feel anything, obviously.
No, they will have very little memory of what's happened. Certainly, in addition to the sedation that calms their nerves, you calm the nerves in their mouth as well with local anesthetic. And so the experience is really one of, it's really simple, and it's such an interesting thing to ask a patient afterwards, so how'd it go? Uniformly, it was great.
No more dentures.
No problem, yeah.
No more traditional dentures.
I don't know why anyone would choose to suffer with the options they have now.
And we should mention, I guess you do it all right there. I mean, you have the lab, you have the imaging, you both have been trained in the surgery.
Yes. I've been trained in both the surgery and the restorative aspect.
Okay. The
artisans that create the teeth that look like teeth. So you literally have to paint a tooth onto a tooth. It's not just a row of chiclets. They're all in-house, and every case is handled as an individual. And in addition, it's making sure that the bite is right, that they fit together properly.
Now, you have strong opinions about something. I'll put you on the spot. You told me in the green room that many dental offices across the country have a philosophy of everybody gets fixed teeth, removed teeth, give them a fixed set of teeth.
Sure.
And you don't like that for everyone.
Right.
Why?
Well, because there are many other options that may not cost as much to begin with. So not everybody, I mean, finances are a real issue for people. And then I guess the other part of that, Randy, is that presumes that I know what's best for you. And I think my job really is to help you understand your choices well enough so that you can make the best choice for yourself. And so, I'm a dental expert, Randy, but you're the expert on you. And I don't forget that when I'm consulting with my patients.
You said some people, because of finances, could start small, like with a snap in, snap out, and then move to teeth that don't come out.
Yeah, absolutely. And that has to do with, I really don't want patients to waste their money either, right? So it's a principle in my practice. Even if we're starting with and going stepwise, the treatments we provide at the beginning will not have to be thrown away at the end. There's something we can build on. So it's a stepwise process. to get you as healthy and chewing and smiling the way you want it to be.
Now we should mention,
Yes.
and if you could do this in about 1 minute and 30 seconds,
Yeah.
your father.
Yes.
If he wasn't your father, he would be wearing a denture.
Yeah, absolutely.
You tell the story better than I do, but about a minute. Go
Yeah,
ahead.
he's the reason I became a dentist. Dad,
Okay.
what should I do? Doesn't matter, son. Be a professional. You have to study the rest of your life. So he was an educator. And God bless him, Randy, he was my patient in dental school. So while I'm doing all my learning, but you know, what I didn't know when I got to dental school was really how to save my own father's teeth. So he was headed for a denture.
Okay.
If we didn't know that, and he lost several teeth that are replaced with dental implants. He's 92 now, Randy. He's got a set of teeth based on dental implants, some of his own teeth, but it's
He
a
can eat
killer.
whatever he wants?
He can eat whatever he wants. It never comes up. He's still at 92, full of life. He was a marathon runner. We actually ran him. When he was 72, we ran the marathon in Athens together. All right, I was his valet that day, and and he's still every day. Although he's getting much better at running now than he used to, Randy. So he says he does 4 miles a day, but he can get that 4 miles in about 800 yards. Okay. So he's a great
So
guy.
there's a lot of people like your father that would have had dentures, but I guess it's hard to talk them into it. Here, it's your own father.
Yeah,
So there's a lot of people that need to know.
And really at the beginning when dental implants were coming out, he did not want them, okay? He actually said, no,
No way.
You've done enough, I'm not doing that. But over time, and when things get bad enough, okay, and really that's what pushes people. So not only me, and it wasn't money for him. He's my dad. I'm taking care of him, you know.
Yeah.
So money had nothing to do with it. But I'm now, come on, let's do this. And
Now he's happy, obviously.
and he doesn't think about his teeth. At 92, it's not an issue. He's still living his life the way he wants to live it, and it just never comes up. Right, you don't have to second guess what you're ordering, what you're eating, laughing out loud. It's important to me.